COVID-19 numbers are skyrocketing in the state, but we are learning better news about Tennessee's death rate. Reporter Valencia Wicker is speaking with an expert who explains why Tennessee cases are less fatal than some other states.
Watch for the ever-changing impact of COVID-19.
So, of course, while we're watching the numbers every day, we know that each one of those numbers is a real person.
2,749 new cases just Thursday, plus 13 new deaths. That means 796 people have died at the hands of coronavirus in Tennessee. Meanwhile, that number is just a fraction of what other states are seeing. Georgia now has more than 3,000 deaths.
In Georgia, they have had about 29 deaths per 100,000 Georgians, whereas in Tennessee, we've only had about 11 and a half deaths per 100,000 Tennesseans so far.
So why is that? Well, Dr. Melinda Bunton says there are three possible reasons. One of them is age.
Here in Tennessee, we did see large numbers of cases among young people, those really aged about 20 to 35 throughout June, and they were one of the single largest groups getting infected.
She says other reasons are time, plus developments in treatment and research.
Over time, we're fortunate that we're getting better at treating COVID patients. So some medical practices have changed, and so we may have lower death rates even among those sick enough to be hospitalized.
Seemingly good news, but Dr. Bunton says Tennessee has a long road ahead.
We have been fortunate that we weren't on the early edge of this pandemic, but with our hospitalization rates rising the way we've seen over the past few weeks, I'm sorry to say that deaths are probably coming too.
All right, Valencia, thank you. Now here is a closer look at the number of hospitalizations across Tennessee provided by Vanderbilt University Medical Center. The number of people recovering from COVID-19 in Tennessee hospitals jumped over the last week. Those needing ICU or ventilators did not see as much of an increase.